Lori. How are you?
Hey, Claudia.
My name is Claudia Gammon, and I am the nurse practitioner at the Blount Memorial Sleep Health Center. Being able to stay awake and stay alert.
Yeah, I'm a lot better.
Good sleep is important just to be able to function normally. We see a lot of patients have problems if they're not sleeping well with daytime sleepiness. They have trouble sleeping at night, and so they aren't able to pay attention like they should during the daytime, or have problems with just cognitive functioning in general, or being able to stay on task.
I'm a shift worker, so I was really tired at night during my shift and having a little bit of difficulty sleeping during the day and going to sleep and staying asleep.
We know that sleep disorders can be related to a wide variety of health issues, and so we see patients that have other health problems like diabetes or hypertension and other cardiovascular issues, and often they have an underlying sleep disorder that they're not aware of. We talk some with patients about what we call sleep hygiene, which are just kind of the basic things that you can do to promote good sleep. And some of those things would be avoiding stimulants. So a lot of people are drinking a lot of caffeine and drinking these energy drinks or using nicotine. And really those should be avoided as much as possible in the afternoon and evening hours. We know that caffeine can stay in the system 8 hours. And so really try not to consume any caffeine after, I usually tell people about noon or 2 o'clock if they typically go to bed about 10 or so. Technology can be a big problem. So there is blue light that's emitted from screens at night, which actually suppress our melatonin production. And that can make it more difficult for patients or people in general to fall asleep at night.
Pull this out.
So the first step for patients that come to see us typically is going to be a sleep study. And now we can do those in the lab, or we can sometimes do those at home as well, depending on the patient. And if a patient is diagnosed with a sleep disorder, we have several different treatment options available. And I think one of the misconceptions is that we only treat sleep apnea here, which is difficulty breathing at night, but we actually treat insomnia, restless legs, and also daytime sleepy disorders such as narcolepsy.
I had mild sleep apnea. I started using CPAP. I've tried several masks, and I finally found one that I like, and it's a nasal mask. So I'm sleeping a lot better, and I'm going to sleep better.
So I think anytime a patient has disrupted sleep at night or daytime sleepiness, they should consider getting a referral to a sleep center to make sure there's not an underlying issue. Some of the sleep disorders, such as sleep apnea, where patients aren't breathing correctly at night, can be linked to other health problems. Things like high blood pressure. We know about 30% or more of patients that have high blood pressure have an underlying sleep disorder. And then patients that have diabetes, about half of those may have an underlying sleep disorder.
I feel more rested, and I feel like doing things, exercising. I walk more, I hike. It just made me feel better.
It's very rewarding to have patients come and tell you that you've really made a positive impact on their life.